Okay, so as we mentioned, this is our extended Q&A session from our training, and we have Dr. Jari Santana-Wynn with us to help us out. So our first question is, as a white anti-racist social work educator, I learned about post-traumatic slave disorder from a mentor in early 2006. I used to integrate the theory into my clinical work, supervision, and my teaching. A few years ago, I read the article, Post-Traumatic Slave Syndrome is a Racist Idea, and stopped teaching these concepts in theory because of the debate that Dr. Santana-Wynn touched on briefly about post-traumatic slave disorder being problematic. Can you please address this critique about the theory being racist more in depth? And can you also include what would be an appropriate response based in critical race theory and cultural humility when a student wants to incorporate this theory into their senior social work thesis, or a social work field instructor at a field site is using this theory?
Absolutely. So there has been debate about this, and unfortunately we couldn't go more into it, but I'm glad to have the opportunity to address it more directly. Candy wrote in that article that post-traumatic slave syndrome is a racist idea because it implies that something is wrong or dysfunctional about Black people, and that even Black people, even progressives, even Black progressives believe this as a way to explain the lack of achievement or lower success in the situations, the social structural situations in which Black people, African American people find themselves in our society. And what he's saying is that when we label Black behaviors as dysfunctional, as it being some kind of innate to our biology, to our culture, then we are blaming Black people for what's happening to them and the situation that they're in. So therefore, it is racist to think that there's something inherently wrong with this group of people, and therefore that's why they are in the situation that they're in, when really the reason that they are in this disadvantage and lack achievement is because of the history of oppression that has denied them the opportunities to achieve the same as other groups within our society because of the structural racism. So the way that we address this is actually that we actually agree. We Professor Kendi, in that Black people have been and continue to be damaged physically and economically and politically by white racism and the legacy of slavery. So we actually agree on that. What we're saying is that our acknowledgement that Black people suffer trauma, does not mean that we consider them to be inferior. It simply means that we acknowledge that trauma has an impact on people, and that we have to address that trauma in addition to fixing the system that created the trauma. But we have to acknowledge that people who experience trauma are going to have a trauma response. And we have enough research across not just interracial groups or racial groups or ethnic groups, but we also have across different ages, we have across different cultures, we have studies about across different socioeconomic status and education levels. Trauma has an impact on people, and it has not only a behavioral impact, but it can also, we have found that it can also change biology, and that from research with the descendants of Jews who survived the Holocaust, we have seen the markers of that trauma biologically passed on to the descendants. And so this does not mean that these people are inferior. If anything, the assumption that trauma and a response to trauma has to be negative or has to be a brokenness is the opposite. We have to believe that many people who are survivors of trauma are actually, it speaks to their strengths, and that these are people of great strength who have survived a lot. And therefore, if we give them the opportunity, and if we remove the system, then they are the system that keeps them oppressed, then they are going to be successful, and they are going to achieve greater things than we could have ever imagined. And so we need to stop kind of comparing or assuming that trauma in the response to trauma is the same as somebody's culture. because as long as we assume that the two things are the same, what post-traumatic stress, post-slavery stress disorder is trying to address is that these two things are separate. That if we separate it, if we remove the trauma markers, if we remove the history of trauma, or if we remove the system that continues to perpetuate trauma and traumatize African Americans and descendants of slaves in this country, that we will see that their culture is actually full of wonderful things, and these people are full of abilities that we have never tapped into because the system has denied them this. So it's important to understand that, and that is where we agree, but we disagree. And again, I think that it has to do with the way that we study trauma and the way that historians understand this idea versus the way that clinical social workers or psychologists are understanding post-traumatic slave syndrome.
Okay, thank you. That was very informative. Okay, so the next question is, what are some ways to make marginalized clients feel safe in your office?
Oh, so there are so many things. So when I present on cultural competency, I say that everything about our spaces tells a story and tells people whether or not they belong there. And so the first thing is your space has to look like they belong there. It needs to be welcoming to everyone. And if I am an independent or private practitioner, that's going to look a little bit different than if I'm in a clinic. In a community mental health clinic, I want to make sure that I have a diverse group of staff, that I have, my documents are printed in different languages and things like that, so that people feel like diversity is welcome here. If I am working in a private office, then I want to make sure that at least my decor is diverse, and that if I'm working with children, that my text, and everything that I work, my dolls, my play equipment is also inclusive and diverse, so that they feel present. It's important to center their voices, and the way that we do that is through storytelling. It's important to bring in their stories, have them tell their story, try to understand their stories, and help them create counter stories. When they are the center of the therapy, then they will feel that they are safe, instead of us bringing in just everything that we know. And I know that this is challenging. I remember going through grad school and one of my professors saying, "You didn't come here to learn how to give advice." And I was very confused. Like, what do you mean? That's what people are going to walk into my office asking for. He said, "No, they're going to walk and ask for advice, and you have to not do that. You have to not give them advice." And I'm like, "Well, what do I do?" And she said, "You have to help them find the answer they already know." And it's true. And if we believe that our clients are way more capable than we give them credit for, and especially with marginalized communities, when we know that the reason they're failing is because there is a system that is oppressing them, that is not allowing them, that is not giving them opportunities to succeed, and we start with that, then we are working with somebody for whom we have way more respect than just you're somebody who's broken and doesn't know how to navigate life. But rather, help me understand what life is like for you, and then let me validate that experience. Let me show you how powerful, how strong, how resourceful you already are, and how the system is what's causing you these challenges, so that then we can be on a common foot in that we are both experts in something. You in surviving this life and this society and navigating a system that is trying to oppress you and destroy you constantly. And me in development and mental health and coping strategies. That's my expertise. And so I'm going to ask you, how do people typically cope? What do you see within your culture that works, and why has it not worked for you? And welcome their knowledge. I am a humble expert. I know what I know, but I don't know everything. And you bring something unique to this room, and together we can synergize and create something wonderful and powerful for you, just for you, right? And I think that when we're creating together, I think that that makes the person feel safe in that space, because it's not my space anymore. It's our space. It's our lab, basically, and we're creating together. So I think that we can do that. And with children, I'm a child and family therapist by training. So with children, it's so much easier. They really are welcoming. As soon as they see themselves represented in a space, they absolutely cling on to that space. And sometimes that means, you know, they want to be my assistant. And I'm like, okay, well, pull out the chair and you get to sit at the desk with me. Or you want to be the therapist today? Fine, you sit at the big chair and I'll go sit at the little chair, and that's fine. Whatever it is, they have to feel that the space, they are free to navigate the space. And our clients, adult clients, the same. I always say, I know that it looks like I'm supposed to sit there, but there's no assigned sitting in this room, so you can sit whatever you want. And I've had some of my adolescent boys absolutely sit in my seat, and that's fine. So I think that there are ways in which we can humble ourselves without being disingenuous. And that I know that I have power in this room when I walk in. I know my title, my education gives me power. And for some of us, the color of our skin also gives us power. So we have to be aware of that, and we can't pretend that it doesn't exist. We simply have to say, I know that I have this power, but when we're together, it doesn't matter anymore to me. So bring it up, make it obvious, name it, the elephant in the room. How does it feel to work with somebody of a different ethnic background? I have an accent, so when I work with people that I obviously have no experience with minorities, I say, I know that sometimes my accent can be a little challenging to understand. Please stop me, ask me to speak slower, ask me to repeat myself, even if it's 5, 6 times in a row. I don't get offended when you ask those questions. So I make it obvious. We don't have to dance around it. I think it's important that if we are transparent with our clients, we are modeling for them how to be transparent with us.
Wow, that is a great answer. Thank you so much. So our last question is, what techniques do you suggest to bring the social activism needed for critical race theory into schools?
Oh, wow. So that is a very good question. I work with an organization, and I actually have been involved with this organization since I was in high school myself, named Activism, and it's a national organization of which we have chapters around the country. It is a leadership and educational achievement organization targeted towards Latinx students starting in high school. In the methodology that we've utilized, the curriculum is what we call the AAA curriculum, which is awareness, analysis, and action, which is we have to first raise the awareness of our students about where their communities and where they exist. We have to help them see, observe, not just like believe what they were raised with, but actually go out and look. When I was teaching undergrad, one of my courses was psychology across cultures. And one of the main assignments they had was they had to attend a religious service of a sect that they had never attended, so that they were not familiar with. So they just had to I kept telling them, you can either walk in or try to get yourself invited. I don't know. If you need help, I know plenty of people. But I told them, I was like, you approach, the leader of a mosque or a rabbi or a pastor or a priest, and you let them know you'd like to attend a service, and they'll tell you when they're going to be, and they'll welcome you. And it's usually, but it was like anxiety provoking for them. And that was important for my majority culture students to experience, because I told them that's what it's like to be an immigrant. This is my life. The entire first 5 years of my life, I was walking into spaces I had never been in and not knowing how they were going to work and so on. So it's that awareness, both experiential of what does it feel like, but also I'm observing and learning things that are different. And so now I'm learning what are the nuances I need to be paying attention to and noticing where there are things that I can learn. We have to prepare, particularly our minority students, for moments where if we're going to have these discussions and when the analysis piece comes up, for moments when they're going to be put on the spot, it's like, is that what it's like? And so we have to also manage that, because we don't want to make our minority students feel like they have to be the voice of Black culture or of immigrant culture, or, you know, but what is it like for you? It's an important question that we have to help our students understand that, you know, one person doesn't speak for everybody, but it's important to analyze this together and help them have these conversations together about what did you learn, what did you not know, what was different, what was missing, what was present that you didn't expect. And then action. Once you realize there is something missing that is important to this community, to my community, then I am responsible for creating it. And what do I need? And then that's where we can help and guide, because what I have found is that, especially with my high schoolers, when I volunteer to work with them on these, they come up with really amazing projects, and some of them seem grandiose. Something about teenagers that they think that they can take on the world. So it's amazing and it's wonderful in many ways, but it can also get out of hand. So we can help them contain it, but we can also help connect them with the people that they need to, if they really want to take it to the next step. We don't have to feel like we have to be the ones to guide them all the way. We have to help them also learn how to be resourceful and manage their people, their resources, their social resources as well. So I feel that that has been effective, and I feel that any educator can utilize that in their classroom with whatever topic or whatever problem. We have done it with homelessness. We have done it with food insecurity. We have handled it with, actually in Delaware, we did with the Dreamers, the Dream Act. We helped them organize and support the people who were marching across the country for the Dream Act, and they wanted to put together a dinner for them. So we helped them get donations so that we got a church to help allow us to open up their basement so we can host the dinner there. So it's doable. And I think that when you start with small little projects, you empower the members of the community to feel like they can lift their community up. And I feel like in African American communities, I think that that's really well known. I feel like churches are very active in creating those changes within the community, but I think that in our schools, both in high schools and also in higher ed, I think that we kind of tend to stay back a little bit more, not quite as hands-on with those projects. But I think if we are members of a community, we need to be participating in improving the lives of all of the members of that community, not just the students that attend our schools.
Yes, I definitely agree with that. Thank you so much. And on behalf of the HRSA team and the entire Westchester community, we just want to thank you again for taking the time out to do this. It is greatly appreciated.
You're very welcome. Thank you so much for all of the interest. This was a wonderful group to work with, and I look forward to working with you in the future.
Yes, thank you.
Bye.